Okay, thank you so much, Janet, for agreeing to be interviewed for
Sure.
this. So I'm going to start off with the first question. Can you provide me with an overview of how you came to have your treatment?
Yes, well, I went for I was referred for a colonoscopy. I thought I only had hemorrhoids, but the doctor, when I had the colonoscopy, told me straight away that I've got cancer, which was a real shock, obviously. And then I was referred on to a surgeon at Withybush Hospital. The appointment there, I can remember it, well, vaguely, but it wasn't a very good appointment. He told me that I was not a candidate for operation because of the position of the cancer,
Okay,
and he would be referring me on to the oncologist, who was Dr. Barrington.
right.
Um, and of course, the weeks keep going on. You wait for an appointment, and then it's another 2, 3 weeks, and then there's another appointment, and another 2, 3 weeks. I had lots of investigations in there as well. And then I saw Dr. Barrington, who then explained to me that I may be suitable for immunotherapy. And
Mhm.
he told me about this new drug called dostarlimab.
So, what did your doctor tell you? Can you remember about the IPFR process, the individual patient funding request process?
Well, Dr. Barrington he mentioned that at this meeting. I only had one appointment with Dr. Barrington when he went through the drug first quite
Right.
extensively. He gave me some paperwork on the drug, told me all about the trial in America and how successful it had been,
Yeah.
um, and did explain to me that it hadn't been approved as yet, but he thought it would be approved later on that summer.
Hmm.
And then he said, but I feel confident that I can get funding for you to use this drug, to start on this drug.
Yeah.
To be honest, I didn't take in a great deal of, how he was going to get the funding. To
Sure.
me, it was only important that, I could get this drug somehow. So
Yes.
I, he gave me paperwork to sign. I couldn't sign it quick enough because
Yeah.
this seemed like my last option by the time I got to Dr. Barrington.
Right.
And like I said, you take in the things you need to know, and you take in the good things. So,
Mm.
you know, I remember the drug was good, the trial was successful, and I was a suitable candidate. So, that's as far as we went, and that was a Thursday before Good Friday. So he said, "Well, we'll let you know," and he was quite confident that he could get funding for me,
Yeah.
but I didn't understand the process of
Okay.
getting the funding.
Right. Okay. So you mentioned about paperwork that you had to sign. Did he ask you any questions before he submitted the application? Can you remember anything about that element?
Um, I can't really, but I mean, most questions are usually about about your symptoms and
Yeah.
and anything else. I can't remember any particular questions pertaining to getting the funding. No.
Right.
Um,
Okay. And the paperwork, did he explain that that was I'm assuming that was the consent for him to submit the application? That it sounds like it was probably that. Is that your understanding as
I
well?
think it was, yes,
Yeah.
yes. I
Okay.
didn't read it. I know
Okay.
I didn't read
Okay.
through because uh, my husband tends to read these things, and I couldn't sign the paperwork quick enough. I mean,
Yeah.
you know,
Was your husband with you at the
it
time that you?
was,
Yeah.
yes.
Yeah.
I don't think he read through either. I mean, this was the first good news that we'd had for about 2 months. Every appointment that we seemed to have was you know, there was no treatment for me. There was no answer to my, you know, my cancer. So all of a sudden, you know, there was Dr. Barrington in front of me saying that there was a treatment and it had, you know, it'd been really successful. So that's all I could think about.
Were you provided with a leaflet about the IPFR process or anything to read online? Can you remember?
I don't believe I was.
Okay.
I don't remember any leaflets. I came away with a leaflet about the drug, about dostarlimab,
Right.
and I can remember looking that up.
Okay.
But beyond that, I don't remember. And to be honest, after that, everything happened quite quickly.
Right.
Because, like I said, this was the day before Good Friday, and Dr. Barrington said he would phone and let me know. And I think I got a phone call sort of almost the end of the following week, with Easter being in the middle.
Yes.
Because I started my treatment just almost 2 weeks after that appointment. So it was very quick.
Lovely. Okay. And then what happened next? Once you said you started the treatment after
Yes.
about 2.5 weeks, 2 to
About 2.5
2.5 weeks.
weeks. Yes,
Yeah.
it was going to be one infusion every 3 weeks for
Right.
6 months. So it was 8 infusions, I believe. And yes, it was very easy. I went to Withybush. The appointment took, the infusion itself only took about 30 minutes. And I was in and out in just over an hour for each treatment. And it was very successful. I had an appointment with the doctor. I think it was in between the first and the second treatment.
Right.
I had no side effects. And he said, "How are you getting on?" And I said, "Well, I've got no symptoms. I have no bowel symptoms. I have, you know, everything is normal." I said, "But surely that can't be the treatment already. I've only had one infusion." And he said, "Yes, you know, this drug has worked really quickly." And from that day forward, I never had any more symptoms from that. And I didn't have any side effects from the drug. So I sailed through for 6 months. I think I got a little bit short of breath after one treatment, but nothing, you know, nothing that, you know, to worry about.
Nothing to delay your treatment or anything
No,
like that?
absolutely
No.
not. No, I had blood tests all the way through and they seemed to be okay. My weight didn't change, my blood pressure didn't change, and I just sailed through for the 6 months until the end. That was last October, when I had another MRI and a sigmoidoscopy, and when they had a look, it was all clear and it was gone.
That must have been an amazing feeling.
Yes, I had an MRI in the middle, about 3 months in, and the doctor actually phoned me and said, "As far as I can see, it's all clear and it has gone already." So that was after 3 months.
Gosh, wow.
Yeah, so a miracle treatment, really.
Fantastic. So how are you now? What's the future looking like for you?
The future is great. I've just had my first 3-month checkup. I'm going to have to go for MRIs and sigmoidoscopies every 3 months, I think, for 2 years, and then it will go down to a year. And I've just had my first one yesterday, and it's all clear. It's all clear. Haven't heard about the MRI, but they've done a sigmoidoscopy, and he's told me that he can't see anything. So I'm pretty confident that there's nothing on the MRI either.
So, that's really good news. Really good news. Oh, fantastic. So going back to IPFR, overall, how satisfied were you with the IPFR process?
Well, absolutely. You know, over the moon, really. I didn't have to fill in a lot of paperwork. I don't remember answering lots of questions, although they probably all came out in the appointment I had. You know, it it wasn't any sort of work for me. It wasn't, any onerous sort of, we might get this funding, we might not. It was absolutely perfect, really.
Yeah.
It just happened for me without any effort on my part.
Thank you so much for your time today. Did
Yeah.
you have any questions for me or?
No, I don't think so. I don't know if I've been very helpful because, like I said, a lot of things you can't remember about these meetings. You just seem to screen it out, and the relevant things jump out at you.
Yeah.
And it's awful to say, but I didn't care where he got the drug from. It just so long as he got it.
Really wanted it, yeah. And I
Yeah,
think that's really important to consider because we can overload people with information, and
yeah,
actually you're right, at that moment in time, that is the principal thing in your brain is, I really, you're giving me a lifeline here. I really want that lifeline, and I completely
definitely.
understand that. So that's really, I know you don't think that you maybe necessarily been helpful, but you actually have, because actually that
Yeah,
nugget is really
yeah,
useful to know, because we can think about how we approach patients, to be able to give them the information and say, look, it's going through this process, this is what it is, and just keeping things simple and easy, and not overloading people, because you just don't have the ability to take all that on board at that moment in
you
time.
don't. No, and
Yeah,
I'm glad I didn't have to come home and fill in lots of forms and then
yeah,
worry about, whether I would get the funding or wouldn't get the funding.
yeah,
Um, but like I said, he got an answer I don't know exactly how long it was, but looking at the dates when I went for the appointment and when I
yeah,
started the treatment, it couldn't have been more than, a week to, I don't think it was even 10 days, because I
yeah.
was, the next thing I knew, I had an appointment for my first treatment.